Hi, I'm Dr. Tina Yen, and I work at the Medical College of Wisconsin at the Clinical Cancer Center at Froedtert Hospital. One question that many women with breast cancer ask is, how do I know if my cancer has spread outside of the breast? Well, fortunately, the majority of women who present with breast cancer today have what we call an early stage cancer, where an invasive cancer is typically confined to just the breast. We examine the patient to look for involvement in the lymph nodes in the armpit, which is typically the first area where cancer will spread. If we don't feel any lymph nodes in the armpit that are of concern, and if radiologic studies also don't show evidence of lymph node disease, then at the time of one's breast cancer surgery, we perform an operation that helps us stage the armpit to let us know whether or not there truly is cancer in the lymph nodes or not. This is called a sentinel lymph node biopsy procedure. And basically you have a lot of lymph nodes in your armpit, and the sentinel lymph nodes are thought to be the first few lymph nodes in the armpit that receive drainage from the breast. So if you have cancer moving from the breast through the lymphatics into the armpit lymph nodes, then the sentinel nodes would be the ones that would first likely have cancer. So at the time of surgery, we remove these sentinel lymph nodes after injecting the breast with one or two different agents. And at the time of surgery, these sentinel lymph nodes get removed. And if there's no cancer in the lymph nodes, which gets determined usually at the time of surgery, then we leave the rest of the lymph nodes in your armpit. However, if there is cancer in the lymph nodes, then oftentimes women will undergo removal of the rest of the lymph nodes in the armpit. For patients with evidence of lymph node disease or present with more significant tumors, we can also determine whether or not your cancer has spread outside of the breast or the lymph nodes in your armpit. And this is typically done with blood work, a chest X-ray, and CT scans of the chest, abdomen, and pelvis, as well as a bone scan, as breast cancer typically spreads to the liver, lung, and bones.